If you're thinking about what specifically a kin over other health professions can bring to a family health team, um, what would you say that would be?
I think kinesiology, you can think of a lot like different kinds of nurses. They all have the same undergraduate degree, but different nurses work in different places. And a nurse that works in an ICU and a nurse that works in, the primary health team where I work have very different experiences and competence. And a nurse that is managing event one day is probably not the nurse the next day who is doing someone's PAP or giving vaccines to babies. They're both nurses. They have the same scope of practice, but their competency is very different.
I was just going to mention, like in our primary care team, our physicians typically will send patients with any type of pain to us before anything else they try. So they may send them for an x-ray before they get to us just to rule out, especially any red flags or any fractures. But we're like kind of their first line of defense and their first option because they really value our opinion on what's going on with their patient. So before they send them on to make that referral to physiotherapy, like I said, if they meet that criteria, or suggest the patient spends any money, they always send them to us first to get some maybe pain management strategies or to get them started with movement, because they know how valuable that is. So I feel like we're very well utilized here where we are. And I know that's not the case in every family health team, but our team is very collaborative, and I'm quite grateful for that because they put their trust in us fully.
I think the interaction between what is health and what is movement is so broad. I think a lot of people think movement and they think exercise, but it's not, which is kind of my thing with CSAP is that there is so much more to movement than exercise. And that I'm not an exercise physiologist, I'm a kinesiologist and I practice movement, I don't practice exercise. I'm not an exercise therapist. My scope is much broader than that, and I provide so many more interventions. There's about 180 family health teams in Ontario, and when I started at my family health team, they'd never had a kin before. We're in a rural area, so I went to our family health team's website to see who else was out there and what they did, and I think there's only about 40 or 50 kinesiologists between family health teams and then the other kind of group funded um, primary care, so community health centers and nurse practitioner led clinics. And between all of those, which is over 200 centers, there's only about 50 kinesiologists. So I think there's so much more space for kins to be utilized and to help improve health outcomes and decrease healthcare costs. When a person goes to their family doctor with osteoarthritis, they might get some generic advice provided in a short appointment, probably 15 minutes. They're probably going to get weight bearing x rays of their hip or their knee and maybe a prescription for medication. They're going to go home and they're going to try to live with that. As their pain increases, they might be offered a cortisone injection. Their physical activity is going to decrease because it hurts to move, and they're going to become more sedentary. They might gain weight. They might start eating more because they're doing less, which contributes to other chronic diseases. And after they've had a couple cortisone injections, or if those aren't working, they're going to end up getting referred to see a surgeon. And this person hasn't received any of the kind of the evidence-based non-pharmacological treatment that we know is super effective, and that programs like the GLAD program, which is a evidence-based arthritis program, should really be first line. Sure, let's give that person some Tylenol or some NSAIDs, but let's get them moving. Let's educate them about what's happening in their body and give them strategies to manage on their own. Suddenly, this person who is in your office in pain, you can't do anything except meds, injection, surgery, has answers. Their health improves, their quality of life improves. They spend less time interacting with the healthcare system, they cost the healthcare system less money, and overall, their life gets better too. So, just with that one condition, which has an extremely high prevalence, a kinesiologist can offer evidence based best practice guideline treatment. And that's just for one condition. There's so many more places where it fits in.
Yeah, I can definitely echo that because I run the GLAD program, and we also run something called Fitness for Health. I don't know if anyone's familiar with that, but we take our patients into the community, to the rec center in Aurelia. And boy, I've had some success stories out of that, because GLAD offers the education piece, which is huge. A lot of people going into it have no idea. They think, yeah, they shouldn't be, weight bearing on their joint, or they should be resting. Pain is bad, etc. By the end of the program, I had someone who was hardly doing anything. This woman went on to do GLAD. She went on to do Fitness for Health because she liked GLAD so much. And by the end of it, there was a group actually of our participants that started going to the rec center independently together, exercising multiple times a week in the community. And it's like, yeah, look at what, that group of people, they're going to keep active, they're going to keep healthy, and they're going to essentially stay out of their doctor's offices a little bit more. So that's what we can hope for.
You're kind of like a much more versatile professional that can address things from the metabolic and community and outreach prevention side, but also do MSK assessment and treatment, also deal with diabetes education, also do expand out. So become really essential to the efficient operation of a family health team, which is amazing.